And joining us now is the Chief Medical Officer, Iman. Good to see you.
Good to see you too.
So, fascinating technology that you're developing. So, going into the red blood cell, opening it up, putting your product in, the red blood cell closes, and then we are off to fight cancer in a big way. How does it work? Tell me from a medical perspective a little bit on, when I understand you've taken some trials, you've done trials in Europe. How difficult is it to find patients for your trials? And what are we seeing as some of the outcomes of those trials?
Absolutely. What is really important about a drug like our drug, which is called the GRASPA, it capitalizes in a very fascinating science. So, as we actually put drugs into the red blood cells, the way it works in certain tumors, particularly in leukemia, for instance, or other hematological diseases, it actually capitalizes on two important features. The first feature is that most of these tumors, they need a protein or an amino acid to grow and to divide. This drug that we are encapsulating into the red blood cells has the capacity to actually eradicate these proteins from the system, and by depleting the system from these proteins, the tumor cells become starving, so they starve because they don't have these proteins to grow and to nourish. And by starving the tumor cells, that leads to they die, basically. So it's a very fascinating science. And this treatment actually, particularly this drug, has been very effective in the treatment of lymphoblastic leukemia. It's one of the very important diseases, particularly in children. And we are all very proud because this disease now, the cure rate in this disease is almost 90% in these children. And many trials over the past 2 decades have shown that this drug has actually contributed significantly to the high cure rate in these diseases. But then you touch on a very important point, which is the patients.
Yep.
And how we find the patients. Leukemia is a very rare disease. Even though here we are in a hematology conference and you think that, oh my God, everyone has, but it's a very rare disease. And finding the patients who are able to take this type of treatment is it's a challenge. But we do work with excellent centers across Europe and across the United States where they get these patients, and where we have the opportunity to offer them a new type of treatment that can help them and help them eradicate their diseases.
Now, are you looking, when you look at trials and you look at setting these up, are you looking for patients who are newly diagnosed, or are you looking for patients who have gone through other treatments and have not responded so well, or is it a combination?
It is really a combination. With any drug that is dealt, normally one will go into patients who were treated, and then unfortunately the disease come back. So you come in and you give that new treatment and see whether it actually shows some activity and take care of the patient outcome. And then you go to patients where they are completely newly diagnosed, where then you start giving the treatment. So it is potentially a combination of both. And in our program, we have treated patients who are completely newly diagnosed, patients who are even not just children, but also adults and patients above 50 years of age. And we have treated patients who have disease and were treated, and then unfortunately their disease came back, and we were able to have them in our clinical trials and show actually very interesting level of activity for those patients. So we have helped in our clinical trials in those patients who came with leukemia.